Hi everyone, my name is Sarah Kazensky, and I did my project on the thyroid disorder Hashimoto's thyroiditis. So, what is Hashimoto's thyroiditis? Thyroiditis means inflammation of the thyroid gland. Hashimoto's thyroiditis is an autoimmune disorder in which antibodies directed against the thyroid gland lead to chronic inflammation. Large quantities of immune cells called lymphocytes attack the thyroid. These kill the cells, tissues, and blood vessels in the gland. Because the lymphocytes attack the thyroid, it is no longer able to produce the adequate amount of thyroid hormone, thus leading to hypothyroidism. Middle-aged women are most affected by this disorder, but men, women, and children of all ages can be affected as well. This disorder runs in families, but it doesn't have to be genetic. Hashimoto's thyroiditis is the most common cause of hypothyroidism in the United States. So, what are the signs and symptoms? Hashimoto's thyroiditis progresses very slowly. People with this disorder may not have any symptoms early on, even when the thyroid peroxidase or TPO antibodies are detected in blood tests. TPO is an enzyme that helps play a role in the production of thyroid hormones. Some people with Hashimoto's thyroiditis experience fatigue, weight gain, and muscle weakness. Thyroiditis causes slow and chronic cell damage, leading to the development of a goiter with gradual thyroid failure. A goiter is an enlarged or swollen thyroid. Hashimoto's will eventually lead to hypothyroidism. Symptoms of hypothyroidism include weight gain, constipation, fatigue, increased sensitivity to cold, dry skin, depression, muscle aches, reduced exercise tolerance, and irregular or heavy menses. The diagnosis of Hashimoto's. So, sometimes the disorder can be diagnosed early on, especially in people with strong family history of thyroid disease, before symptoms of hypothyroidism present themselves. Mild elevation of serum TSH is seen with normal levels of thyroid hormones and positive TPO antibodies. Hashimoto's thyroiditis can be diagnosed by finding a goiter upon physical examination and laboratory tests consistent with hypothyroidism. These laboratory tests would show an elevated serum TSH and low thyroid hormone and elevated antibodies against TPO. The medication and management of Hashimoto's. Patients with elevated TPO antibodies but normal thyroid function tests do not require treatment. For people with hypothyroidism, treatment consists of thyroid hormone replacement. Synthetic levothyroxine taken orally at an appropriate dosage is inexpensive, very effective in restoring normal thyroid hormone levels, and results in improvement of symptoms of hypothyroidism. Most patients with Hashimoto's thyroiditis will require lifelong treatment with levothyroxine. When levothyroxine is taken in the appropriate dose, it has no side effects. Insufficient dosage results in serum TSH remaining elevated and symptoms of hypothyroidism. If the dose is excessive, serum TSH will become suppressed and patients may develop symptoms of hyperthyroidism. Now, exercising with Hashimoto's. When exercising with Hashimoto's thyroiditis, one needs to be very careful not to do too much. Too much exercise could work against the thyroid. Adequate amounts of time are needed to restore normal levels of thyroid hormones, T3 and T4. Thyroid hormones are necessary for energy utilization, so proper rest time is needed to avoid an overwhelming feeling of fatigue. It is most important for a person with an autoimmune disorder such as Hashimoto's to exercise. Exercise is proven to boost the immune system and reduce inflammation in the body. For someone with Hashimoto's, exercise could reduce inflammation of the thyroid and reduce how often flare-ups present themselves. Another reason exercise is important for them is because exercise can help to maintain or lose weight. A sign of Hashimoto's and hypothyroidism is weight gain. To combat this weight gain, exercise is used to stay at a healthy weight or to lose weight gained from this disorder. Now I'm going to go through my case study. First I'll go through client details, then risk stratification, risk group, goals, and considerations. So first, my client's details. My client is a 30-year-old female who weighs 87 kilograms and is 165 centimeters tall. Her exercise history is that she played sports in high school, but now lives a sedentary lifestyle. Sedentary lifestyle means that she doesn't exercise. Family history, so she has no previous heart problems in her family. Her FBG levels are 110, her HDL is 40, LDL is 140, and she developed hypothyroidism 2 years ago. Her medications that she takes are synthetic levothyroxine, as mentioned before, to help combat the hypothyroidism. And she is a non-smoker, and her blood pressure is 124/80. So her risk stratification. We'll start with age and go from there. So her age is not a risk factor because she is under 55 years old. Her family history is also not a risk factor because she has no previous cardiovascular disease in her family history. Her cigarette smoking, she does not smoke, so it is not a risk factor. Her sedentary lifestyle, however, is a risk factor because she does not exercise on a daily basis or at all. Obesity is also a risk factor because her BMI is over 30 kg and it's at 32. Hypertension is not a risk factor because she has a normal blood pressure. Dyslipidemia is a risk factor because her LDL is over 130, it's at 140. Prediabetes, she's also a risk factor because her FBG is over 100, it's at 110. And she does not have the negative risk factor because her HDL is under 60. After going through the risk stratification, we are able to see that her risk group is the moderate risk group because she is asymptomatic for cardiovascular disease, but she has more than 2 positive risk factors. She has 4 positive risk factors in the risk stratification we did before. So her positive risk factors were dyslipidemia, prediabetes, obesity, and a sedentary lifestyle. So my client's goals. My client's goals are to gain general strength and work on cardiovascular endurance. She also wants to lose weight, join a gym, and participate in exercise classes. She finds that she does well better in group fitness exercise classes because there are more people there to help guide her in her fitness journey, and she doesn't have to do things on her own. So, special considerations when you're exercising with Hashimoto's. As stated previously, exercising too much, too often, and with minimal rest can counteract the benefits of exercise and cause fatigue. Moderate intensity is best for people with autoimmune diseases because they are not working at their maximum effort, but they are getting their heart rate up and staying healthy. Because my client is taking synthetic levothyroxine, she can exercise just as she would if she did not have Hashimoto's and hypothyroidism because her condition is regulated with medicine. The medicine has no side effects, so she is able to exercise as normal or tolerated. So, the exercise testing that I chose for my client for body composition is skin fold measurements because that's a good way to determine her BMI. I chose muscular strength test, the 1 hour bench press and 1 hour back squat because I wanted upper body and lower body. For muscular endurance, I picked the YMC bench press test and the sit-up test. For flexibility, I chose a sit and reach test. And for the cardiovascular endurance test, I chose a 1.5 mile run or walk, depending on what she can do, and will be timed. So, after exercise testing, we move on to exercise prescription. So for my client, I decided that her exercise prescription should be about 3 to 5 days a week, starting with 3 just to get her into it. And then her intensity should be moderate intensity, so 12 or 13 on the Borg RPE scale. Time, she should do at least 30 minutes a day. And 2 types. So I want her to do 2 to 3 cardio days and then 1 to 2 weight training days. So for the cardio days, I want her to choose 30 or more minute classes for cycling, aerobics, water aerobics, swimming, or whatever other classes that they have to offer for cardio. Or she can do cardio alone. So if she chooses to do cardio alone, she can do a 5-minute warm-up, a 20-minute workout, and a 5-minute cool down. And this could be on a bike, a treadmill, an elliptical, a rower, whatever kind of cardio she chooses. And then for her weight training days, I thought that she should choose either a 30-plus minute class, of either body pump or whatever other weightlifting classes they offer. And then she could also weight train on her own. So if she chooses to weight train on her own, she should do a 10-minute cardio warm-up, and that could be, again, bike, elliptical, treadmill, rower, whatever she decides. And then 6 lower body machines and 6 upper body machines. And she should do 2 sets of 10 reps each, just to start her off. Now, I chose machines because she's not used to working out. We don't know how her balance is, so we want to be careful with the beginning of working out. So we're going to ease her in with machines, and then as she becomes a pro at those, we'll move her on to free weights, maybe some Olympic lifting in the future, depending on if she wants to or not. And yeah, so I also chose 2 sets of 10 reps because we don't want to push her too hard in the beginning, but keep in mind that this is just her beginner's exercise prescription, and as she continues to grow through this prescription, we will add modifications if we need to, and we can also add progressions. So she will definitely progress. This is just the beginning. So in conclusion, exercising with a thyroid disorder, especially Hashimoto's thyroiditis, has many health benefits as listed above. It can help with the immune system, and it helps with inflammation in the body. Physical activity is beneficial because it helps improve the immune system. And with the condition under control with the medication, the client should be able to exercise just as someone without Hashimoto's. So just because she has Hashimoto's does not mean that she cannot exercise. As long as she is medicated and everything else is right with her health, she should be just fine to exercise just as someone without Hashimoto's would be able to exercise. Just to keep in mind, you want to make sure that we don't exercise them too much or too often, because that could do more damage than good to the thyroid. We want to make sure that she has adequate time to rest and gain her T3 and T4 levels back so that she is ready to go for her next exercise. Thank you very much.